Hello, everyone. Welcome back to another session of A Day with your fertility specialist. I'm Joanna Damina, your host for today. As always, we have a very interesting topic, but before we get into that, let me introduce you to our guest today. We have Dr. Deborah Olubi on set today. Welcome, ma'am.
Thank you very
Good
much,
to have
Joanna.
you. Yes, ma'am.
It's always a pleasure to be here. Good
Mm-hmm.
afternoon, viewers.
Good afternoon, everyone. So, in case you're joining us for the first time, welcome. And in case you're joining us for the umpteenth time, welcome again. If you're joining us for the first time and you do not know Dr. Deborah is a fertility specialist and the IVF coordinator here at Alps Hospitals. So, she has a lot of insight on the topic that we're going to be discussing today, which is fertility preservation for a career woman or a career focused woman.
Yeah.
I mean, nowadays, like there's a shift in the way that women think,
Yeah.
considering career and getting themselves together and then building a family.
Yeah.
It's a little bit different from how it used to be before. I know a lot of people in my peer group are saying, oh, they're going to get this, do this, and do this before you try to settle down. And thinking about having all those things, I think most of the time, timing really matters.
Yeah.
Yeah. So is there a misconception that you've had, especially in your experience with women that come in that don't really put the factors of, timing with their reproduction and their reproductive cycle into place?
Yes, that's a very good question. Yes, so like you said, the world is changing.
Yeah.
The generation of women we have now, a lot are career, focused. A
Yeah.
lot want to establish themselves in the career. A lot of people want to be able to do things for themselves
Mm-hmm.
without necessarily having to depend on others.
Yeah.
Yes, so like you said, one myth I've recognized is that they feel that they can always come back to that issue of conception, having
Mm-hmm.
a family at any time. But unfortunately, a woman's biology was not wired that way.
Yeah.
Yeah, so there's a timing. A woman has a biological clock that is ticking with respect to your ability to have children.
Mm-hmm.
So that's something that a lot of women, career focused women do not think about. They always think, oh, once I'm done with this, I can always come back and have children at any time. But
Yeah.
it doesn't work that way. A
Mm-hmm.
woman's biological clock is not wired in that way. So for a woman, fertility declines with age. There's a time when a woman is most fertile.
Mm-hmm.
There's a time when a woman is producing eggs that she can use to have children.
Children, yeah.
And there's a time when, unfortunately, this clock winds down and it becomes increasingly difficult for a woman to have children.
Okay.
Yes, so women are most fertile in their early 20s.
Hmm.
By the time a woman is going into her 30s, this clock starts winding down.
Okay.
And by the time you get to your mid 30s, from about 35 years of age, the chances of you conceiving spontaneously starts to go down.
Yeah.
Yeah, so the number of eggs you have left, the quality of eggs you have starts to decline
Oh, wow.
markedly at this
Hmm.
age, at about the age of 35.
Right.
So that's why a woman, in as much as you want to achieve some career goals, everything must be put into focus and you
Mm-hmm.
must strive to achieve a balance. So you see that if you're not able to achieve your goals related to pregnancy, having children, then you must consider fertility preservation.
Exactly.
Yes, so that
Yeah.
when you are ready, even though your biological clock has wind down,
You
there's
still
still
have.
something that can be done.
Mm-hmm.
That's if you took that decision when it was important
Yeah.
to look into fertility preservation.
Okay, so speaking about fertility preservation, what are some of the things that a woman can do that she can say, okay, you can go ahead and focus on this and then come back, to start your fertility process?
Okay, yeah, so there are quite a number of things you can do, and the two most common ones you can do is to think of either freezing your eggs
Mm-hmm.
or to think of freezing embryos
So that's freezing your eggs when you're in that
when you are in your
ideal.
fertile,
Yeah.
yeah,
Okay.
especially below the age of 35 years.
Okay.
So you freeze your eggs at this point. The eggs are kept for you.
Mm-hmm.
So when you are ready to start a family, these banked eggs can now be used at this time.
Okay.
Yes, and then the other option could be to freeze embryos. Embryos are what you get when an egg is fertilized by a sperm.
Mm-hmm.
So some of these women could even be married, but as a couple, they're not ready to start a family at that time.
Yeah.
Both of them,
Yeah.
the man, the woman, they're pursuing some goals, career goals, business goals, whatever goals. There are a lot of reasons why people might not be able to have children or start a family, as early as they would have wanted. So whatever goals they're pursuing, these embryos can also be frozen. And then when they're ready to start having children, these embryos can be used.
Okay,
Yeah.
okay. So that's just that kind of gives us an idea of individualized based care and also as a couple, coming together.
Yes,
Okay,
yes,
that's
exactly.
interesting.
Yes. So if you don't have a partner, you're
Mm-hmm.
not married, we'll think about freezing
Freezing eggs.
eggs. But
Okay.
if you're married and you're not ready yet, you could freeze embryos.
Okay, so speaking
Yeah.
about fertility preservation, I'm sure there's some things that you need to evaluate at first before
Yes.
even doing that. So, what are some of the things that will give a woman an idea of what her fertility prospects are like in regards to,
Yeah.
holding on or egg freezing or embryo freezing?
Okay, definitely. So there are lots of things we need to do. The woman has to be evaluated. Age is a very important factor, and I've spoke about how age
Yes.
determines fertility.
Mm-hmm.
So other evaluations we do would want to do a scan,
Okay.
looking at the uterus, looking at the ovaries. In the ovaries, we're looking at what we call intrafollicular count. This can give you an idea of the number of eggs a woman has left,
Oh,
her
okay,
ovarian
interesting.
reserve,
Yeah.
yes. And then we do other biochemical tests, blood work like anti-Mullerian hormone
Mm-hmm.
AMH, which tells you the reserve, the gives you an idea of the average eggs she has. Like I mentioned, a woman is born with all the eggs she would ever use
I
in her
mean,
lifetime at birth. You don't
imagine
produce
that.
new eggs.
Yeah.
Yes, so each menstrual from when a woman reaches starts menstruating, reaches
Mm-hmm.
menarche, when you start menstruating, that the cohort of eggs that are destroyed at every cycle. So you can
Wow.
see that reserve keeps diminishing.
Mm-hmm.
Yes, so AMH will give you an idea of what that reserve is like.
Looking like, okay.
Yes, what is left in the ovaries.
Okay.
So, and then other tests that could help are things like your hormonal profile, because fertility is not just based on the eggs. Eggs are
Mm.
important. Other factors have a part to play
Yeah.
in a woman getting pregnant. You talk about the sperm quality too.
Okay.
You talk about the uterus. Is the uterus healthy? Are there fibroids? Are there other pathologies like adenomyosis? You talk
Um,
about the lining, the endometrium, the inner lining of the womb where pregnancy actually happens.
mhm.
Are there issues there? Are there adhesions? Are there masses there? Are there polyps? Are there fibroids there? So, and then the overall health of the woman, her reproductive system, are her tubes blocked? Are the tubes open? Are the tubes diseased?
It's a
And
lot.
our overall health, does she have other
Yeah.
medical conditions, hypertension, thyroid issues, diabetes? So all that. So fertility and pregnancy is not just one aspect. Is looking at the woman holistically. That
Exactly.
so all those other evaluations can be done.
Mm.
So that you now give her a picture of what her fertility is like, how optimal her fertility is.
Mm-hmm.
And then with that picture, she can now take a decision to know whether, she needs to do something immediately,
Now,
or
yeah.
she still has some time
Yeah.
to wait.
I mean, that
Yes.
sounds like a lot.
Yeah.
I think most of the time when people are trying for a baby or trying to conceive, they just look at one thing. You look at just
Yes.
the reproductive
Yes.
system, but
Yes.
your whole body is
Yeah, so
involved in
a
that
woman that is
process.
diabetic, that is poorly controlled,
Hmm.
chances of conception are going to be lower,
Oh wow.
and then chances of miscarriage, if she even conceive, is higher.
Yeah.
Yes, so all those other things are quite important.
Okay, well, I think that's very interesting and it builds a really detailed picture of what your decision making process can be like. Let's go back to the options that you had spoken about earlier,
Yeah.
egg freezing and embryo freezing. I'm sure it doesn't just happen. You don't just retrieve eggs and
No,
then freeze them
they
or
involve a
get.
process.
Yes. So
Yes.
can you give us, a guideline or a step by step as to how you get to attain the
Okay.
level of retrieving eggs before even freezing them?
Yeah, so to get the eggs, that you would either freeze, or embryos that you either freeze, the woman will have to go through an IVF treatment process.
Okay.
And this usually involves injections. She's on
Mm-hmm.
hormonal medications. She's monitored at various times.
Yeah.
Serial scans are done.
Okay.
And then there's a day that we take her to the theater, the IVF theater, where the eggs are retrieved.
Mm.
Yes, so if we're freezing eggs, those eggs are then checked, the matured ones are then frozen. And then if we're thinking of freezing embryos,
Yeah.
then her partner or husband brings the sperm, which is used to fertilize the eggs. And
Okay.
then the embryos are incubated in the lab for a few days. And then these embryos are then frozen.
Frozen. Okay.
Yes.
So of course this is, like you said, it's a step by step thing. You're doing
Yeah.
this before you do that and do this. So for a career focused woman that may not have how would I say the luxury of time
Time.
because I know
Yeah.
yeah you may have to go in and request for this and do that. What's what's the timeline like, and how often do you actually need your clients or the woman to be there in person, that they may need to take that time off of work or
Okay.
anything like that?
All right. So we try to make the process as seamless as possible. We try to go through the process in such a way that it doesn't really affect our life so
Yeah.
much. Yes, like I mentioned, there are injections involved.
Mm-hmm.
The earlier injections are injections that we could teach her to give herself for
Okay.
women that are open to that.
Yeah.
The way people that are diabetic on insulin give
Mm.
themselves daily injections at home.
Okay.
So the syringes are like those used to give insulin. So they are
Okay.
tiny needles,
Yeah.
and a lot of women, and these injections are just under the skin.
Mm-hmm.
So a lot of women can give themselves these injections
Okay,
at
that's
home.
nice.
At home.
Yeah.
So those earlier injections, we could teach her to give herself at home, and then later when we go to the other injections that are intramuscular, these ones for most women you will need someone to give you. So the injections are not timed, so you can just come in your break period, your free period, just
Mm.
quickly come into the hospital and you get the
Even
injections
after work.
even after work.
Yeah.
Exactly, you get the injections, and then the timing or duration you'll be on the injections depend on the kind of protocol we're using
Okay.
to stimulate the ovaries. So but averagely between 2 to 3 weeks.
Mm.
Yes, you'll be on this injection for between 2 to 3 weeks.
Okay, that's still a good amount of time.
Yes,
Yes, that
yes. So and
seems
then just a shot and you go
feasible.
back. It's
Yeah.
just on some days that you might need to have a scan. That those are the days you might spend a little longer in the hospital.
Mm-hmm.
Apart from that, you just come and get your shot at any time in the night, anytime convenient for you, and then you just go back.
Okay, so when you get to the point of egg retrieval,
Yes.
is that something that takes a whole day?
Well,
Is it 2 days? Are you going to
no, no,
need to
no.
be in the
Egg retrieval
hospital? Yeah.
is a very short procedure.
Mm-hmm.
No, it's just that the medications we give to remove pain,
Yeah.
and so on. Different people recover from them at different rates.
Yeah.
So it's not the whole day, but we would ask that you take that day off work because we
Okay.
don't know how the drugs will affect you. Some
Mm-hmm.
people still remain drowsy and sleepy for quite a longer time,
Yeah.
quite some time.
Mm-hmm.
Yes, so the procedure is just a few minutes and then you're out, but it's for you to recover from the effect of the drugs now.
Okay.
Yes, so
Okay.
some people recover fast, they even drive themselves back home.
Mm-hmm.
Yeah, so it's not the whole day.
That sounds nice.
Yeah.
I mean, I don't know about you, but I don't know. It seems like it's a bit of a steal. Through the whole timeline, it works with your convenience.
Yeah,
She's
we
able to
as
come
much as
in.
possible we try
Yes,
to
you're
work with
coming
the
in for your
convenience.
injections and your
Yes.
scans, and it's trying to follow your convenience as much as
Yes.
possible. And you just have one day where you may or may not spend the day in
Yeah,
the
a
hospital.
lot of
You can
people
leave
even do
earlier.
this
Mm-hmm.
procedure and they're not even domiciled where the hospital is.
Oh,
You just
okay.
keep following them up on phone,
Hmm.
yes, and all that, directing them through video calls,
Yeah.
voice notes, and so on how to go
Oh,
about the process. So they
okay.
only come to the hospital for the key events
Mm-hmm.
in the treatment process. So we try to make it, as easy and stressless for our
For our
clients.
clients.
Yes, as much as possible.
That's really beautiful. I hope that gives you a better feel going into it. It's not something that you need to be
To
in the
take time
hospital for.
off,
Yeah,
you don't need to
exactly.
take time
You
off
just come
work.
in and do
Yeah.
certain things just for a short period. And then when you said in the beginning, the first few injections that you get, so you can give yourself at home. It
Yes.
also boosts that whole feeling of being very aware of what you're doing.
Yeah,
Yes, your
being
confidence.
involved and being
Exactly, being involved. Thank
part of the
you.
process.
Being involved in the process. So, there's this famous stereotype about how hormones affect women, especially in the place of work, that once this happens, you're
Yeah,
going to be this, you're
mood
going to be cranky.
swings.
Yes. So can you tell us about that? So this actually
Yeah, so any medication has side effects,
hmm.
but who develops the side effects? That's a different story. Yes.
Yeah.
So a lot of these, most of the side effects from this medications are things like hormone, mood swings,
Hmm.
maybe heat intolerance, hot
Hot
flushes.
flushes,
Yes,
okay,
hot
yeah.
flushes, maybe pain, slight discomfort at the site of the injection.
Hmm.
But and then so a woman can be a bit irritable, the mood can be fluctuating. But for a lot of women do not even notice any changes. A lot of women take these medications and they do not have any changes.
And even when a woman might have those mood swings and irritability, it doesn't affect your mental capacity to work,
No,
does it?
definitely
Okay,
not.
that's great.
These
Yeah.
hormones are the same hormones that work in your body
Yeah.
throughout the menstrual cycle,
Hmm.
that leads to ovulation happening,
Okay.
menstrual flow coming. No, so they're basically the same hormones, just that
That you
now we're
already
giving
have.
them from outside the body, we're giving
Yeah.
them exogenously, yes.
Hmm.
So a lot of women, it doesn't affect their ability to do their work, to concentrate at work. Their capacity is not impaired in any way.
Okay, so
Yeah.
that's also something as well, because I know there's that stereotype of, oh, once you're irritable, you can't, it's just like how you go through your normal
Normal
cycle. It's
life,
just,
normal life.
yeah,
Some days you're down, some days you're up.
exactly.
Mood changes. And you're able to
You're
regulate
still able
everything
to
and
work.
still perform your what you need to do. Yeah.
Okay, so don't be too worried about
No.
that, please don't. But as well as the process of fertility preservation, a lot of people think it is 100% thing, right? Like everything, once you do it, you just have to do it just once and you're good. Like that's the hope that you don't have to come back. But does a woman need to go through multiple cycles of IVF in order to freeze eggs, or is one okay? You have to do two.
Yeah, so a lot of factors will determine that. Like we
Mm-hmm.
said, the age as which is coming for this fertility preservation, the age as which is having this IVF,
Yeah.
to get eggs to freeze or to get embryos to freeze. So her baseline characteristics, what's her baseline, ovarian reserve like?
Okay.
What are the other issues she has, hormonal
Mm-hmm.
issues? But when with polycystic ovary syndrome, we know that that impacts on egg quality. So those are all the things that will determine if she would need to have more than one IVF cycle
Yeah.
to generate the eggs. So if we do one cycle and you're able to, because we would want to counsel that you should have about 8 to 10 eggs to freeze,
Okay.
and we do one IVF treatment, and you get 12, you get 13, you get 14 eggs, and
That's
the
it.
embryology says the eggs are mature, their qualities are okay,
Mm.
then that is fine.
Okay.
Yes,
Yeah.
but if depending on the age, because some women still wait until they're getting to their early 40s, their late
Mm.
30s, 38, 39, and sometimes you do this and you don't get a lot of eggs. So those kind of women, you want to still counsel that they have more than one cycle so that you can generate more eggs,
Okay. So it just
to freeze for them. Yes.
so it
So a
just
lot of
depends on
things
the
will
person.
determine, yes,
Yeah. Okay.
what happens.
So it's
Yeah.
an individualized thing.
Yes, it's an
It's
individual. There are a lot
okay.
of people that do just one
Mm-hmm.
IVF treatment and you get more than enough eggs to
But
freeze.
do you have an should I say age range that you mostly see your clients coming in for?
This egg freezing, a
Yes.
lot of people come in their late 30s.
Oh
And
wow.
we've mentioned that ovarian
It's
reserve is already
already
declining
yes.
from about 35 years age. So
Hmm.
people actually come late. I think they come when it's already no, 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 facing them. They're already looking at it in the face that,
Yeah.
oh,
It's going to be
I'm
difficult.
getting old
Mm-hmm.
in quotes.
Mm.
But we would want people to be aware that this should be done earlier. This should be a decision you make earlier,
Yeah.
because the earlier the younger the woman is, the better the quality of the eggs, and the more eggs you are likely to get.
Yeah.
But if you're waiting till you're 38, 39, 40s, ovarian reserve has already
It's going
declined
back, yeah.
significantly. Yes.
Well, I know that I don't know, but I feel like a lot of our viewers are within, the younger age
Age.
group, because I mean it's social media. So so in case you're
Honestly.
watching and you're within this age range that Dr. Debbie has said
Early
your most
30s.
fertile, yes, your
Yeah.
early 30s
We
to.
encourage people early 30s, you
So you
come
could
in.
also come in and do that. You don't have to wait until you're already struggling
Mm.
to, especially if you have goals in mind. Just because
Yes.
you want to have a family doesn't mean you need to put all your goals at the back. If it's something that you would want to focus on and you feel like maybe having children at this time may not be the best for you, just look at that and just come in anytime. Earlier is best, but
Yeah.
if you've already gone towards that age, you can still come in and have other
And
options,
evaluate, yeah, and then
yeah,
we'll
available to
evaluate
you.
and give you your options.
So, did you want to say something?
Yeah, so
Mm-hmm.
I wanted to say that, the earlier you are, the better.
Mm-hmm.
And the fact that you have eggs or embryos frozen doesn't mean you can't still conceive spontaneously. So it's
Exactly.
just still a bank.
Yeah.
Yeah, so maybe subsequent pregnancies or you want more babies, you could still fall back on those eggs.
Mm-hmm.
Yeah, so they're like an assurance or insurance.
Yeah.
Yeah, when you have those eggs or embryos frozen, they're like insurance. But if you ever eventually decide to, one of the reasons why people freeze eggs or embryos is because maybe there's no partner yet,
Mm-hmm.
even though they're focused on their career and other things.
Mm-hmm.
You won't just be waiting around for a partner. They do
Yeah.
other things with their life, move on and all that. So that might be the reason why they're not planning to have a family now.
Mm-hmm.
Yes, so you could always freeze your eggs and then maybe they now settle down and they're still able to conceive spontaneously. It
Perfect.
doesn't mean that those eggs or embryos are wasted. You could
Yeah.
always still fall back on
On
them
them.
for future of other pregnancies.
Mm-hmm.
Yes, so it's
Mm.
not a waste, it's banked there and you can bank eggs for as long as you want.
I feel like that's,
Yeah.
I don't know, but I feel like that's smart, like, let's say you've frozen your eggs and
Yes.
then you eventually settle down and
Yes.
you get pregnant spontaneously,
Yes.
you give birth to this baby, let's say you've already had two, but then the more
You want
time,
some space, or you
yeah,
want to space them?
exactly, the
Yeah.
space, the years are going by. So you can always fall
Exactly.
back on those
Exactly.
the
Because
healthier eggs that you've already kept
thank you,
frozen.
healthier eggs, because the more older the woman is, you
Yeah.
know, the higher the risk of a lot of issues,
Mm-hmm.
having miscarriages, giving having a lot of chromosomal abnormalities in the eggs, and this
Yes.
can give rise to children with a lot of issues such as Down syndrome. So the
Okay.
younger the eggs, the more healthy the eggs are.
Mm-hmm.
The younger the age, the eggs, the
Are
younger the
frozen,
age a
yeah.
woman is, the healthier the eggs are,
Mm-hmm.
and the lower the chances of having children with some of these, chromosomal abnormalities, which are more common with the older eggs.
Okay.
Yes.
Oh,
So the
so
longer the eggs stay, the incidence of chromosomal abnormalities in the eggs are higher,
also,
and that's
yeah.
why pregnancy is the chances of having pregnancies from those eggs is lower. Yes. So that's why
Okay.
infertility is more at that age.
Yes.
Yes.
Okay.
So it's
That's
a
good.
win-win. You don't
It is
lose anything.
actually,
It's just
yeah.
like having something saved for future use.
Mm-hmm.
So even if you don't use it in future, you've not lost in any way.
Yeah.
Yes, but that is like a safety deposit that
For
you have
you.
there.
Mhm.
Yes, insurance against whatever.
Yeah.
Yes.
That's interesting. I mean, it's actually a very, like you said, it's a win-win, and it's a good thing that is being spoken about
Yeah, a lot of
more.
people don't know there's something they can do.
Exactly.
A lot
Yes.
of young ladies out there don't know that you can bank your
They
eggs.
just keep thinking there's time. There's
Yes, they
time.
keep thinking, and then they think maybe there's nothing they can really do.
Yeah.
It's not in their hands.
Mm-hmm.
After all, a woman won't marry in our culture. It's not a woman that goes to pursue a man.
Yeah.
It's a man that comes to pursue a woman. So she'll be like, I'm not the one to marry myself. Yes, she's
Mm-hmm.
not the one to marry herself, and she's not the one to start running after the men. Yeah, but there's something you
You
can do
can
to
do.
take your destiny in your hand. You
Yeah.
can bank your eggs.
Okay. Well,
Yes.
I mean, of course, if eggs are frozen, then they will need to be thawed or
Yeah, when they want to
defrosted.
be used,
Yeah.
yes.
So, about the quality of the eggs on thawing, how do you speak for that? I know. I don't think it's the same thing. But let me just talk about
No, the
when you
quality,
freeze.
if good quality eggs were frozen,
Mm.
thawing, when eggs are frozen, they remain in that state.
Hmm.
Yeah, so what you froze is what you get when the
That's
eggs are thawed.
amazing.
Yes,
Science is
the
really
quality
interesting.
doesn't diminish.
Mm-hmm.
Yes, so it's what you froze that you get.
Okay, so I have a question here that I feel we might need is it has more specific time age ranges. It says if a woman freezes her eggs at 31, um meets her partner at 34 and gets pregnant spontaneously at 36 and never uses the eggs, what are the options? For instance, is there an option of discarding, research, donation, other things you can
Is it
do
just
with
one child she's going to have?
I don't
There's an
know.
option to still use it. We
Yeah.
just talked about a scenario that, yeah, so for another subsequent, so she's at 36. Was it
Mm-hmm.
at 36 she got pregnant?
Yes.
So at 36, ovarian reserve has started diminishing. So
Mm-hmm.
maybe her next child, she wants it after 3 or 4 years. She's
Yeah.
already 40.
Mm-hmm.
So those eggs she froze are better than the eggs she would have at 40.
Okay.
So it will be better for her to have another pregnancy using the eggs she froze.
That's interesting. But
Yes.
I think another part is when if those eggs are not used
Used.
in the yes, what
Okay,
could
so it's the couple that will tell us what to do with
okay,
it.
okay.
Yes, like you said, they could be discarded, they could
Mm-hmm.
be used for research, you could even donate it to other
Mm,
people. Yes, so
that's
those are all
nice.
all options that are
Yeah.
available
I
for
mean,
you.
that's actually interesting. I mean, speaking about
Yes,
the donation part, especially because you only have most of the time you say a young, healthy person, but if you're not even going to use those, it might
yes.
actually help to
Help another couple.
yes help another couple achieve their
Yes.
own level of their family and the dreams that they have. I think most of the time those are the questions that people have on their mind around waiting and fertility preservation, especially in terms of focusing on their career. Was there
Yeah.
anything else that you've noticed in your experience or anything else that you want to tell young ladies out
Yeah,
there?
so it might not just be career why people are not able to, start their families or have their families when they want to have
Yeah.
the, have the children. So if a partner is not on the horizon,
Mm-hmm.
yeah, so those are other issues. Some other personal circumstances, even schooling, education.
That's true.
Yeah,
Yeah.
so a lot of reasons. So it's not just because of your career. A lot of maybe your partner is not in the country. No, so it's not just single ladies. Even married couples sometimes might need to consider fertility
Preservation.
preservation. Husband and wife are in different country. Maybe the husband is pursuing something,
Mm-hmm.
and it's not the optimal time
Yeah,
to
we
have a
actually
child,
see that a
and the
lot.
woman's age is going.
Yeah.
Yeah, before the ovarian the reserve start declining significantly, should consider freezing her eggs.
Okay.
Yes, or even embryos can be frozen.
Mm-hmm.
Generated with the husband's sperm and then kept for when
For
they're
when they're
ready
ready.
for to try for pregnancy.
Yeah.
Yes.
I mean, I think this is so, science is so mind blowing. Like, this is
Yeah.
something that growing up I never would have thought of. I
Yeah, and
really would have thought
it,
about
nowadays,
that.
the kind of IVF we see people doing a lot is egg donation.
Hmm.
And because people wait until they are much advanced in age, and
Yeah.
at that time ovarian reserve is
It's
almost
already.
zero,
Hmm.
and they have no option than to consent to using donor eggs. But
Yeah.
if their eggs were frozen earlier in life,
We
they
could
would have
have.
been still been able to use the eggs. Yeah.
Okay. Well, thank you so much, Dr. Debbie. It
Thank
has
you for
been
having
very
me.
insightful,
Always a pleasure to be
especially
here.
especially as a young woman myself,
Mm,
and I hope this appeals to younger ladies out there. And even if you're not a younger lady, but you still have this dream of, you know, um, building a family and settling down and all that, you can always come and talk to our fertility specialist here at House Hospital. But for a young lady that is either career focused or doesn't have a partner yet, you can still do something about your fertility. You can still bank on something. Like
yeah.
like Dr. Debbie said, it's an insurance.
Mm.
And just the way you'd insure your car, your life is also a very important aspect of your life, especially if you take this as something that is crucial for you. Always, you can always go ahead and look at your options. It's not a one, it's just there's not just one path to go towards. It's life. You have different things that you can try out. So thank you so much for joining us. This has been very insightful. I hope you have gotten some knowledge about that. We're always here to give you more knowledge and hope that you make more informed decisions about your life, your fertility prospects, and all of that. Thank you for joining us. Thank you for every engagement. Every time you click, every time you share, every time you like, every time you comment. We really do appreciate it. And we will see you next time. Please join us on Facebook, Instagram, and YouTube. Sometimes TikTok for my TikTok people out there. We go live every Wednesdays and Fridays by 3 p.m. So please join us next time. Have a lovely day. Bye.